Are you planning on correcting a recessed chin or wide jawline in the near future? Is jawline surgery safe and what can go wrong? While thousands of patients achieve beautiful results with jawline surgery each year, there are some serious complications that you need to understand before undergoing surgery. Hi, I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I specialize in facial contouring of the full face and do hundreds of jawline surgeries, including sliding genioplasty and jaw contouring. And I'm here to tell you what to expect during and after your procedure so that you're fully informed. I'm going to walk you through potential complications of jawline surgery that every patient needs to know about, not to scare you, but to help you make an informed decision about your care. So, if you're considering jawline surgery, stay tuned. This could be the most important video you watch before making your decision. Jawline surgery is probably the hardest procedure I do to recover from, and that's because it takes a long time to fully heal. It is a very big surgery and it's in the mouth, which makes it affect your day to day life in more ways than in other areas of the face. There are a couple of things inherent to jawline surgery as far as risks go, like any other, and one is bleeding. We make incisions inside the mouth when I do jawline surgery and nothing external, but there are some blood vessels inside that can be damaged, especially back in the back towards the mandibular angle. So there's risk of bleeding both in surgery and afterwards where your incision can be a little oozy. This is very rare, but can happen. And the major risk that I tell all of my patients is infection. We are inside your mouth. And so your mouth is full of bacteria that can get into the surgical wound. You use a medical mouthwash called Paradex both before and after surgery, and that helps decontaminate the area. I also have you on some fairly strong antibiotics afterwards that cover all the bacteria in your mouth. Despite that, if you do have any sort of dental issues afterwards, like an infected tooth, or if you don't take your antibiotics after surgery, you can get an infection. I've even had a patient that had a delayed infection even months after surgery because she had an infected tooth in the area around surgery. I remember in particular one patient that I had that I prescribed antibiotics to, but she was very resistant to taking the antibiotics. So without telling me, she didn't take them. And a few weeks after surgery, she showed up with an infection with fluid and pus coming through the skin here. And so I had to actually make an incision and drain that fluid and place some packing. And it took a long time for her to heal. As long as you're taking all of your antibiotics and following your instructions, the incidence of infection is still rare considering how many of these procedures I do and how few patients I see with infections. Nevertheless, it is a higher risk than other procedures I do on the face and neck. Like with any other surgery, you can have potential for scarring, but the incision is in your mouth, so there's nothing visible. The incision is in a crevice in your mouth where your gum meets your lower lip, and that incision can pull over time afterwards because your chin will be swollen. I recommend that you keep the compressive wrap on even that whole first month, especially while you're sleeping, because it takes weight off that incision. If it pulls apart and opens in certain areas, it will still heal, but it can create little crevices that are hard to clean. And I usually will recommend you have a water pick at home to clean in those little crevices. Again, most of the time it heals very well and you can't really feel it once it's fully healed. One thing that I have seen a fair number of times after jawline surgery is seroma. We're most of the time reducing the size of the jaw, either reducing the width or projection of the jaw. Occasionally, I'm actually increasing projection with a sliding genioplasty, but a lot of times I'm making the jawline a lot smaller and more narrow. Anytime you're in an empty space in the body, you create a potential space that can fill with fluid. Your body wants to fill all those empty spaces with fluid once you have everything closed. This is why I have a compressive wrap going up and down, and then you'll keep that on the whole first week after surgery. And even after that first week, I usually recommend you keeping it on as much as possible just to give some support to the skin so it readheres to the bone and as well as the muscle without any fluid collections underneath. Once you pass that initial healing phase, there are things like jaw bras that you can find on Amazon, other places online that may be a little bit more comfortable for you. I like in those first few weeks for you to have an ACE wrap so you can adjust the tension, because that swelling will fluctuate quite significantly in those first few weeks. And I don't want it to be too tight. But I'll be able to tell you when you can graduate to more of a jaw bra so that it's more comfortable for you. One thing that you can see is delayed healing. And I see this more in patients who are smokers or are vegans or plant based. And that's because they're not getting in enough protein. I usually recommend you having at least 100 to 150 grams of protein a day. So I recommend supplementing all your meals with a protein shake, starting a couple weeks before surgery and going into a couple weeks after surgery. If you're a smoker, or if you are not telling me you're a smoker and continue to do that, will delay your healing significantly. It can cause infections and your incisions to open up. And if you have been a nicotine user, I will do a nicotine test in and around your surgery time to make sure that's fully out of your system so that you can heal adequately. One thing that I see with delayed healing is prolonged swelling. And that can be really disturbing because you feel like you have Jay Leno chin for a while. And everyone's a little bit different with how quickly that goes away. We do give you something called a gua sha stone to help do some lymphatic massage. But if you are overly active, if you just can't sit at home and you want to go back to exercise a little too soon than what we tell you about, you will get more swollen, more risk of seroma, more risk of infection. So take it easy that whole first month, and then we'll tell you when you can start doing some lymphatic massage so that you can heal in the average amount of time. Another thing that people worry about is asymmetry. And we all have asymmetry in our face. We're not completely symmetric no matter how much we want to be. But with jaw contouring in particular and with sliding genioplasty, we can correct for those some. You'll never be able to mirror image one side of your face onto the other, but we can correct some asymmetries. I have never had a situation where someone was so asymmetric that they wanted a revision. Theoretically, this could happen, but I've never had it happen before. Doing jaw contouring in particular is almost like an art. So it's like doing sculpture. I'm removing millimeter by millimeter of bone until I see that it looks really good. It does take an artistic eye to know when to stop and when to keep going. My goal for you is to have an aesthetically pleasing contour of the entire jawline and create as much symmetry as possible while still keeping different structures safe, like your tooth roots as well as nerves. And this leads me to something else that can be expected but can be more prolonged, and that is numbness. There are two nerves, one here and one here, called the mental nerve, that sit in the area of our surgery. And I actually leave some muscle and some tissue right around those nerves just to give it a little cushion, because we're using retractors to gain access to the bone, and that can put stretch on the nerves. I've had some patients come who have had surgery elsewhere who have permanent numbness because those nerves were completely cut. And I went in and revised the bone itself, and I could see that the nerve was no longer coming out of its natural opening. And so that can lead to permanent numbness for the rest of your life if we're not careful. I expect that because of the stretch on the nerve, you will have numbness temporarily around the chin. And that can last several months, and that can be very annoying at first, but it does come back. And once it comes back, it can start as like pins and needles sensation. And then you can have little kind of shock like sensations, and then it'll fully return over time. One thing that I always caution patients about, just to let them know ahead of time, is they will have some changes in their smile right at first. And that is because I have to go through this muscle here called the mentalis muscle to gain access to the bone on the chin. And so we cut through those muscle fibers. I do suture them back together in the end, but the mentalis muscle has to adhere back to the bone, and that can take, a couple weeks to a couple of months. At first, when the muscle starts coming back to life, you'll see some dimpling on the chin, more so than you did before. And then in the end, those muscle fibers all start firing all in synchrony, and you go back to the same sort of contraction as you did before. We all have some dimpling in our chin, like you can see here. So it's not completely smooth, but you tend to notice that a lot more after you've had jaw surgery because you're looking in the mirror a lot more, you're looking at your jaw a lot more. So that's completely normal. That's just because the muscle fibers of the mentalis muscle attach to the skin surface here. If that bothers you, we can do a little Botox and smooth that out. With facial weakness, one thing that I do caution patients about is facial weakness laterally. So if you have a facial nerve that's not sitting in the right tissue plane, say like you've had a facelift before and those tissue planes are disrupted, you can have some temporary or permanent facial weakness. Now, I've never seen this, but it can happen. And there are some studies out looking at where the facial nerve lies in relation to an intraoral incision for jaw contouring. And so, if the nerve is sitting a little bit close to the bone, because we're using powered instruments to contour the bone, theoretically that can be damaged. But again, I've never seen that happen. Because we're working in your mouth, both when you have the breathing tube in place and because we have retractors, powered instruments going through your mouth, you can have damage to your teeth or your lips. I'm very cautious about this. And usually, when I'm in surgery, I'm looking under magnification, but I have staff with me who are looking very closely at your lips and your teeth to make sure we're not putting too much pressure in any areas. But again, anytime we're in the mouth, you can have damage to that area, either with small areas of burns or chips to the teeth. Never seen that happen, but theoretically, it can happen. And lastly, one thing that I tell everyone before surgery is that if we're reducing the size of your jaw significantly, you can have some skin laxity along your jawline. We're reducing the structure underneath. So if you don't have a lot of elasticity to your skin, usually somewhere around 6 months after surgery, I'll be able to tell if you have a little bit of skin. Some patients need to go back in after the fact and tighten the skin. If you're younger, I can usually do this with something called FaceTight. It's a radio frequency device that I can use a probe that goes underneath the skin to tighten everything back up. And I can do that in the office under local anesthesia. For patients that are a little bit older who don't have as much collagen and elastin in the skin, I'll need to go back in and do a neck lift, make incisions around the ear, and actually lift up all the muscles and skin on a deeper level to create a nice smooth contour around your new jawline. If you have any questions for me, please leave a comment below or contact our office at 512-537-4191. Don't forget to like and subscribe to our channel and feel free to keep looking for content as we post things throughout the year.